Hi, my name is Dr. Matthew Connor and I am a surgeon at Tallahassee Ear, Nose, and Throat. Today, we are talking about the sinuses. First, what are the sinuses? The sinuses are hollow spaces in the bones around the nose that connect to the nose through small, narrow channels. They produce mucus that serves to moisturize the inside of the nose. This mucus layer protects the nose from pollutants, microorganisms, dust, and dirt. It is a way for us to filter, warm, and humidify the air we breathe in order to prepare it for entry into the lungs. In a way, the nose is the gateway for fresh air. The mucus is normally cleared from the nose by tiny hair cells called cilia, which push the mucus through the sinus channels and into the back of the throat, where it is swallowed. The sinuses stay healthy when the channels are open, which allows air to enter and mucus to drain out. Sinusitis can result from either viral, bacterial, or fungal infections. Part of the body's reaction to the infection causes the sinus lining to swell, blocking the channels that drain the sinus. This causes mucus and purulence to fill up the nose and sinus cavities. You know you have sinusitis when you have cloudy or colored drainage, plus a stuffy and congested nose, and pain, pressure, or fullness in the face and eyes. For patients who have recurrent sinusitis or chronic sinusitis, we will often get a CT scan to evaluate their sinus anatomy. We can often get this scan in our office at the same time as your appointment. The CT scan may show us the extent of sinus disease and any anatomical variants that may predispose you to mucus buildup and infections. Medical therapy usually consists of sinus rinses, decongestants, anti-inflammatories, antibiotics, and allergy medicines. When medical therapy has been unsuccessful or is not feasible, then we consider sinus surgery. Sinus surgery is performed to open up the narrowed channels, allowing mucus to flow and also allowing easier delivery of topical medications, such as nasal steroids and sinus rinses. At the same time, we remove any collections of mucus, polyps, or diseased tissue that can contribute to your symptoms. We can also culture sinuses directly to determine what type of infection may be causing the problem and then treat with the correct medications. Patients with asthma and sinusitis may benefit from sinus surgery as well, given the strong association between sinusitis and asthma. Moreover, when the sinuses improve, asthma symptoms improve, and the need for asthma-related medications decreases. Sinus surgery has been shown to decrease the number and severity of infections. This surgery has also been shown to enhance quality of life, reduce need for antibiotics, and decreased number of missed work or school days. So, what are the risks of sinus surgery? The potential complications of sinus surgery depend upon which sinuses are opened. When the maxillary and ethmoid sinuses are involved, there can be damage to the eye since it is directly adjacent to both of these sinuses. Complications may include excessive tearing, black eyes, double vision, or even blindness. Fortunately, the incidence of any of these is far less than 1%. The operations involving the ethmoid, sphenoid, and frontal sinuses occur very near the brain and surrounding spinal fluid. Disruption of the bone around the skull can lead to air around the brain, leakage of spinal fluid into the nose, and meningitis. The risk of a brain fluid leak occurring is around 1 in 1,000. We are very aware of these potential risks of surgery and do all in our power to prevent it from occurring. One of the reasons CT scans are performed before the surgery is to make sure there are no abnormalities in your particular anatomy that would predispose you to one of these major complications. We typically use a CT guidance system intraoperatively to further lessen the risk of complications. There is also the risk of loss of sense of smell, which is estimated to occur in less than 1% of cases, although most of our patients report a significant improvement in their smell. Minor nosebleeds may be expected, but rarely patients may experience a severe nosebleed. If this happens, the bleeding may need to be stopped either in the emergency room or with another surgery, but this is very rare. If bleeding occurs, spray oxymetazoline, also known as Afrin, into your nose. 2 sprays into each side that is bleeding every 5 minutes for a total of 3 times. And apply a gauze pad or tissue paper under the nose and rest, sitting with your head up for approximately 30 minutes. If you still have minor bleeding, you may repeat this procedure. Try not to remove the gauze pad unless it is completely saturated. The pad will help the blood to clot inside your nose. Because bleeding is a risk, we ask that you not take aspirin-containing products for at least 10 days prior to your surgical procedure. We would like you not to take ibuprofen drugs for 5 days before surgery. In addition, we would like you to discontinue any herbal supplements you take the week before surgery. Avoid the use of any nasal decongestant nose spray for 14 days prior to surgery. Post-operatively, you should not undergo any strenuous exertion, straining, vigorous nose blowing, or heavy lifting for 2 to 3 weeks after your surgery is performed. Generally, you will go home the same day of the surgery, and most people find they have some discomfort for the first week or so after the surgery, after which it becomes remarkably decreased. Your surgeon will sometimes put you on antibiotics, steroids, as well as post-operative pain medications. We will have you begin sinus irrigations in order to minimize crusting in the nose. You may have a small pack in place to keep your sinuses open. This will be removed the week after surgery. You may also need to come back to the office post-operatively on a regular basis in order to keep the openings, which we create surgically, open and patent. After the sinuses are completely healed, there is an 80 to 95% chance that you will not have significant problems down the road with your sinuses. The exceptions to this are patients who have aspirin sensitivity, asthma, and nasal polyps, who tend to have a higher rate of recurrent sinus problems. After sinus surgery, you can still get colds and infections. However, with your sinuses now wide open, these infections will be easier to control with rinses and overall less painful and bothersome. You will also notice that your nasal medications are more effective now that your sinuses are open and the medicines have improved delivery. We hope this video has helped you to understand the risks and benefits of sinus surgery and what to expect during your recovery. If you have any further questions or concerns, please contact our office at any time.